It's all new at 5 o'clock. President Joe Biden is now declaring monkeypox a public health emergency in the United States after more than 6,600 Americans have been infected with that virus. The CDC says more than 500 cases are now confirmed in Georgia. That's the sixth highest in the nation. So, with the federal public health emergency declaration, what does that actually do? Tonight, Evan Kozlov verifies.
We spoke with James Hodge, a health law professor from Arizona State University, Megan McGinty, an epidemic and disaster response expert from Johns Hopkins University, and we looked at information from the Administration for Strategic Preparedness and Response. A public health emergency declaration is made by the Secretary of Health and Human Services, Xavier Becerra in this case.
It would allow HHS to instantaneously do some things that it can't presently do quickly.
It enables Becerra to hire people, make grants, enter contracts, waive certain requirements, and access additional funds.
Usually during emergency declarations, like with opioids or things we've seen in the past, there actually would be a freestanding fund ready to be used for devoting to these purposes. We've been working to refill that fund post-COVID, and to my knowledge, to date, it's not yet been refilled. In fact, Congress has been reticent to do it. Now, monkeypox may change its mind very quickly, but the sheer fact is the funds that normally would be there to the tune of millions of dollars simply may not be at this point in time.
It can also allow states and local jurisdictions to purchase general supplies at reduced cost. McGinty says there's also a symbolic value.
The act of making an emergency declaration calls attention to a problem and says this is of significance that we as a country need to be paying attention to this.
With your Verify, I'm Evan Kozlov.
So as all this new information continuously comes in, we've been getting a lot of questions from you about monkeypox.
Our Karis Belger has been working to get you answers.
I've reached out to doctors and the state health department to answer three main questions about monkeypox. The first question, who is eligible for the vaccine? The Centers for Disease Control and Prevention recommend the vaccine be given to people who've been in close contact with someone who is infected in the last 14 days. Anyone with a sexual partner who may have been exposed, or anyone who has had multiple sexual partners in the last 14 days in an area with reported cases. We also received questions about vaccine availability. Specifically, can you get the vaccine at a local doctor's office or pharmacy? Dr. Carlos Del Rio, a professor of medicine and epidemiology at Emory Health, explains this is not the case.
The vaccine currently is available at health departments and a few specific healthcare systems. But no, it's not available in your local drugstore, so don't go to your local CVS asking for the monkeypox vaccine because they're not going to have it.
This next question is from a viewer message. He says, I wanted the vaccine for monkeypox, but no one within 60 miles has it. I live in Jefferson, which is in Jackson County, and we just have nothing available. I reached out to Governor Kemp's office and received an email that said the following: testing and vaccinations are available in all health districts. When I called the Jackson County Health Department, I was told they did not have vaccines available. And just before we came on air, the Georgia Department of Health did send me an email saying a very limited number of vaccines are available in the Athens Health District, which includes Jefferson, and appointments are available for those who are eligible for the vaccine.